Hey, good morning or good afternoon, depending on where you are. Welcome to today's webinar on the Accountable Care Learning Collaborative. My name is John Pullman. I'm the Executive Director for the Collaborative, and I'll be moderating today's call and presentation. We are excited about today's webinar and the opportunity to share more about Western Governors University, their relationship with the ACLC, and the benefits that relationship provides. So I just want to start by giving a brief explanation of the relationship between the Accountable Care Learning Collaborative and Western Governors University. Many of you have familiarity with either the Brookings ACO Learning Network or the similarly structured Levitt Partners Accountable Care Cooperative, led over the past few years by Mark McClellan and Mike Levitt, respectively. So going back about a year ago, as Mark and Governor Levitt discussed the potential of merging these organizations to create one geared to this next phase in accountable care, the early question was where to house it. They felt strongly really on two criteria: that it be a nonprofit environment that fits the mission and the collaborative spirit of the members, and they also wanted it to be in a progressive organization that aligns with the work we are engaged in. So they identified Western Governors University really as the top candidate and where the Accountable Care Learning Collaborative is now housed. You'll shortly learn more about WGU if you don't know about it already, but in short, as accountable care is a disruptor in traditional healthcare, WGU is really a disruptor in transforming higher education. Mike Levitt does have a personal connection with WGU as he was one of the convening founders while serving as the governor of Utah. And actually, 2 years ago, he convened a council of healthcare experts to help design a curriculum of a new online master's degree, and that's what we'll be talking about today. The degree is designed to educate mid-career professionals in how to adapt in a quickly evolving accountable care environment. You'll recognize a number of these names, including 3 of our own members who are participating, some of our own current ACLC members, including Intermountain, American Medical Association, and Craig Miller, who's now moved over to Accenture, and we're grateful for their input there and their ongoing insights into this rapidly evolving and dynamic program. As the host of the ACLC and the believer of the mission, WGU is offering a discount on tuition for any employee of a member organization for this degree. So to give a little more explanation on this and other details is Rebecca Roese.
Great. Thank you very much, John. I appreciate that. And thank you all for coming today and attending our presentation about the Master of Science in Integrated Healthcare Management. I'm Rebecca Roese. I'm the Product Development Manager for this program at Western Governors University. And I'm very excited to be a part of this. I'm actually fairly new at Western Governors, just been here, I'm on my 3rd month. So it's really exciting to me to be able to dive into this program and see what we have to offer our students and the healthcare community. So we'll jump right into some of the details. Our agenda today is we're just going to look at some of the details about the healthcare management degree program. Again, we developed this degree with the help of the advisory panel, so we really focus on what's going to be important to you as a graduate. And we're going to talk a little more about Western Governors University, the competency-based education model, and then as John referred to, we've got some scholarship opportunities and tuition offers at the very end. So the purpose of this degree is really to prepare you as a graduate to be successful in the healthcare system as it evolves. We recognize that most of the students coming into this program have previous education and experience in the healthcare field. So we want to develop what you already have into a transformational leader, into a healthcare strategist, a value innovator, a tactical manager, and an analyst. So these are the core areas, the core competencies that the entire degree program is focused on. On the next slide, we have the Integrated Healthcare Management Student Profile. In 2013, we identified general careers such as clinically oriented administrative roles, health information roles. The healthcare management roles aren't going anywhere. In fact, they continue to increase. And we wanted to make sure that, again, our program relevance was spot on with what managers and administrators in the field needed to be successful. So there was over 145,000 clinically oriented administrative roles, which aligns really well with this integrated healthcare management role. And you can look down this list. I won't go through every single one. But you can look down this list and see there's obviously a lot of jobs available, a lot of career advancement available, and we align the program with the advisory panel to ensure that the competencies in the curriculum within this program are appropriate. The Integrated Healthcare Management Program is a combination of typical courses that you would see combined with 10 different projects. And the projects are based on Bloom's taxonomy, if any of you are familiar with that, where you start at the bottom with identifying and describing processes and procedures. You evaluate and apply your knowledge all the way up to analyze and create. So as you move through the projects within the program, they will all culminate into the capstone, where you're actually analyzing and creating solutions to healthcare problems within your community. So the 4 terms that it's broken into, the next slide is the identification of the first term. So the first term focuses on leadership, innovation, and integrated systems. It is a combination of 2 courses and 3 projects that really help build innovative leadership skills, effective management techniques, and strategic thinking. An example of one of the projects within your first term would be creating a plan to help underserved populations gain access to medical care. There is special emphasis on communication and collaboration throughout this first term to help you recognize effective communication techniques, how to identify stakeholders in your community that are important to help you, and how to really come up with collaborative solutions to real-world problems. The next term is quality finance and analysis. This term focuses on Lean Six Sigma principles and strategies, data analysis, and you will utilize those in one of your projects to decrease wait times in a level 1 trauma center. So you'll take this financial information, you'll take these statistics that are offered to you, and within the 3 courses and 2 projects, really build on those Lean Six Sigma principles to utilize strategy to improve healthcare. The next slide is term 3. In term 3, we're looking at enterprise risk management, health information technology, and population management. Again, as healthcare professionals already recognize that technology is very important throughout every aspect of healthcare, and this third term allows you to analyze data that you have collected and utilize that data to create risk management plans, to utilize that technology to increase care for at-risk populations. So one of the projects is reducing health disparities in a certain population throughout the risk management and technology process. Term 4 would be the final term of your program, and this is 1 course, 1 project, and then the capstone also falls within term 4. So community health and integrated health are the focuses of this term. And again, we're building all of this up to the analysis, evaluation, and creation that will become your capstone project. So the student completes a prospectus and a business plan to identify a problem area in the healthcare industry. And what we really want to encourage is the student to look within their own healthcare community, to look to their own healthcare leaders, identify a real-world problem, and create a solution to that problem. So with the prospectus and business plan, we want students to be able to carry this out to the real world. We don't want just a paper that you write and submit to us and you get a grade for it. We want this to really be able to grow your professional network, your professional portfolio, and be an accomplishment that you can be very proud of that had a positive impact in your community. The next slide is a picture of what your transcript would look like. So these are the names of the courses and projects and how they're broken down into terms. Western Governors, again, because it's competency-based, they're not credits, they're considered competency units, but it's a very similar structure to a typical credit load that you would see in a semester. So here is how that breaks down over all 4 terms for a total of 35 competency units. One of the best things about Western Governors University is you can look at those 4 terms of courses and identify that you have education, you have experience in the field, and some of these courses are going to be easier for you than others. Western Governors University allows you to really take advantage of your knowledge and experience and apply it to your degree so you can reduce the seat time. If you take more than those 9 competency units within that first term, then you can start on your second term within the first term and it doesn't cost you any extra. So we measure learning, not seat time. It is 100% online, which is very important to all of us that are juggling school and work and families and social lives and everything else that comes with it. And we have really great online learning resources to support you through that. And again, that flat rate tuition per term means you can take as many courses as you can pass within one term without additional cost. So it's the same cost per term no matter how many courses you finish. The one-to-one mentor model really allows us to give students individualized attention. The traditional model on the left, we can see everything revolves around the professor, and this is what we see in typical brick-and-mortar schools. The professor's at his desk, he's got a couple of TAs, and the students and the professor are launching out from the professor as the nucleus. At Western Governors University, we have the student as the nucleus. We have course mentors and student mentors that give you success both in and out of the classroom and really give you that support that you need to be successful. The courses are designed, again, to accommodate adult learners, to accommodate professionals in the field who have previous education. And again, we're aligned quite particularly to ensure that they can be used in your professional growth. Again, we have online learning portals that gives you access to your textbooks, to e-resources, to your assessments and assignments. All of those things are contained within your learning portal as well as your grades. And then the very outer layer of this amazing circle is all of our support. So we have assessment teams, we have course development teams, student services there, we have library services to offer, and then you also have your peer support. So you can communicate with other students who are going through the same program as you, and again, you're branching out that professional network and you're just identifying another support for yourself. Tuition is charged at a flat rate per term, like I said before, and you can take as many classes as possible within each term without any extra cost. The term lasts 6 months, and we don't have fall semesters or spring semesters. Based on your schedule, you can start the first day of any month. So if aligning with a typical 6-month term doesn't fit within your schedule, you can start absolutely at the beginning of the next month and get started on your master's degree so you can get through quickly. We're offering a $2,000 total healthcare scholarship with preference being given to ACLC leaders, and the $2,000 is split up to $500 per term. So it'd be $500 per those 4 terms. And again, with that flat rate tuition, you're already getting quite a deal, and this will have quite an impact on that financial side of it as well. ACLC members will also get a 5% tuition discount off of their total. And as a thank you for attending today's webinar, the $65 application fee will be waived when you apply by May 1st. Please make sure that you enter the code ACLC on the application form, and you can apply either by calling the 877-435-7948, or you can visit wgu.edu/MSIHCM. And again, that's the Master of Science in Integrated Healthcare Management degree. So thank you all for your time.
Great, thank you, Rebecca. We do have one question here, Rebecca. The question is the degree open to anyone with a bachelor's degree?
We do have an application process. A bachelor's degree is obviously required. We do give preference to those who have a variety of healthcare experience. So our ideal student is coming in with some healthcare experience just to ensure more success in the program. But we do evaluate students individually as well. So even if you're not sure, we encourage you to apply. We can evaluate to ensure that the program is right for you.
Rebecca, I think this one is related to it, but are there any qualifications required to enter the program, such as other education requirements?
At this point, there's no licensure or certification that's required as a prerequisite. Nope. Again, really what we're looking for is those who are working in healthcare already, so they have that base knowledge. But other than that, again, we just encourage everybody to apply. So there's no specific prerequisite.
Great. Another question is, so how long will the degree take to complete? You talked about terms, and you'd be able to start on the first day of any month, but what are different scenarios in which that could look like for different individuals?
So all total, the 4 terms typically are 2 years. So if you move through exactly as we have written here with your terms, it would take you 2 years to complete this. Again, a lot of people are coming in with a lot of previous knowledge and previous experience, so it may not take a complete 6 months to complete all of those competency units in term 1. So if leadership and innovation, the 1 competency unit course is really easy for you, you may finish that even in a couple of weeks. And then you move on to innovation projects and finish that in a couple of weeks. So if you complete all of your term 1, let's say in 4 months instead of 6, then you can start on the courses listed within term 2 while you're still in term 1. And that would knock it down a couple of months. And you can complete that a little faster, and it would knock it down a couple of months. So depending on your own comfort with the courses, your own comfort with the content, and your own level of expertise in these areas, people could complete in as little as a year, or it could take the full 2 years.
So another question on the demographics of your of students there. What's the profile of a typical student do you think would benefit most by this degree?
Somebody who is at a mid-management level, who wants to move up within their industry or within their company. So, again, maybe you've been a healthcare manager for a couple of years, you're looking to get into executive management. Or you have been patient-centered for several years and you're looking to move into that administrative side of things. So you have been in management, or you have been an employee and you want to move into a management position. We want to offer any student who's looking to really just move up in their field, the opportunity to do so with this degree. So again, we're looking at those who are looking for an opportunity for advancement, and this degree aligns really well with industry standards, with what you need to know to move into that higher level of management and up into executive level management. With the analysis and the financial information, the ability, again, with those transformational leadership skills to identify what's most important to you and what's going to be the most beneficial to you to be able to advance your career.
There was a notice that you talked about the tuition discount, but not the full cost of tuition per term. Can you talk about just what this degree will cost in general?
I don't have a specific number, and I'm not sure if anybody from financial aid is in the chat box by chance. I don't have a specific number. It is a little variable based on transfer credits if you have funding sources, so I'm hesitant to say a specific number. If anybody's here that has something more specific, feel free to toss that into the chat box. But the flat rate term doesn't ever increase. So, for example, again, I hate to throw out the wrong number. Somewhere around $3,000 per term, so $6,000 per year. And if you took the full 2 years, then it would be approximately $12,000. Again, if you finished all of the competency units in 3 terms, then you're dropping that other $3,000.
There's another question that came in about, do students get access to ACLC information? And I'll take that one, Rebecca. We really like this partnership and the value that students can get, by participating and how that syncs with the work ACLC is doing. So there is a student membership access, essentially, so any student enrolled in this master's program can get access to all the intelligence and the webinars and the information we provide while they're enrolled as a student. Rebecca, I have another question that's about comparing this degree versus an MHA, a Master's in Healthcare Administration. Could you sort of describe the advantages and disadvantages perhaps over someone choosing between an MHA and this degree?
Absolutely. I actually have a degree in MHA, and I can tell you that I'm a little jealous this degree didn't exist when I was out looking. A Master's of Health Administration is really a very general degree. It's the equivalent of an MBA, where you get an overview of the things you'll be doing in the field, an overview of how to create a budget, of how to make sure your staffing is appropriate if you're an administrator in a hospital. What's missing from a lot of the general degrees that WGU offers is really the analysis, the transformational leadership skills, the collaboration skills that we offer within the projects and the courses. So focusing on the project, we want students to get in and really get their hands dirty and be able to problem solve at a very high level. So when we talk about finances in the healthcare industry, we're not going through a budget and saying, here's how you have to recognize your finances. We're going much more in depth than that and saying, here's how you analyze your finances. Here's how you're strategic about planning how to spend your money and how to make more money from the community, and how to get your stakeholders involved to balance your finances within the healthcare field. So it's just taking it one step further from more of the generic healthcare administration programs and using the amazing resources we had to create this program to identify what's actually important for employers in the field, what's important for a CEO to be able to accomplish in his office. It's not creating a budget, it's analyzing finances, right? So we went in a little deeper. We took that thinking to a higher level. We really focused on the analysis and creation in that hierarchy of learning to make sure that it's one step above a healthcare administration degree that you could get into another school.
I just got a note coming in from one of the people from financial aid with a clarification on the cost, and if you look at a term rate at $3,395, that's tuition and a learning resource fee. If you take in the 5% discount, you're really looking at $3,232 per term. Now, it was mentioned before that you can take more CUs per term and accelerate your the time to complete that degree and end up paying less. So that's a general ballpark. I know there are other relationships and financial aid situations which might adjust that. And I believe in this last slide you can see there's an opportunity at the bottom. There's a phone number where you can call to get more information. One other question that came in is about books. Are there books and other materials that need to be purchased, or is everything provided online?
Everything's provided online within your student portal. So we use a lot of ebooks, we use a lot of online resources, and you can access all of it through your student portal. So there's no going out and buying another $150, $200 worth of textbooks per course.
Rebecca, we appreciate the time you spent here. We appreciate the questions that came in. We will, if you have additional questions, you can send them in. You can email them to members@accountablecarelc.org, and we've responded to that. You can reply to the email we'll send out shortly. And again, we'd love to connect you with a representative if you want some more detailed explanations or clarifications of how your company can benefit from this. So. Rebecca and those others of you from Western Governors University, we appreciate your time and we're grateful for this partnership.